Okay. Hi, Nursing 472 classmates. My name is Danielle Crum. I am from Carbondale, Illinois. I'm ER nurse, and lately I have been doing PRN in long-term care, so that's a new crossover for me. And I did my practicum hours in the long-term care environment. So I just did the presentation earlier this morning for my project. My fingertips have regained feeling. I get very, very anxious. This is a little easier for me because I can't see you, but I have really bad anxiety. So my presentation was on infection prevention and control. I did a PowerPoint and presentation. Yeah, PowerPoint with presentation. And I had some members of the administrative staff at the location sat in, which was probably my hardest thing, was to get everyone together. There's not a whole lot of staff in the building at one time. Like, it seems like there is, but there isn't. It's just very, very busy all the time. Very busy, very short-staffed in long-term care. Everyone's doing so much that, multiple people have multiple different hats they wear. So getting everyone to sit down and spend their time with me was difficult and very much appreciated, because I know they probably didn't want to. Not that they didn't want to, they were just very busy. Anyway, so my site was in Anna, Illinois. I did infection prevention and control. I wanted to really do like a broad presentation on like a generalized infection prevention and control. I am PRN and I do like the float pool. I do different facilities. I primarily work in Carbondale facility, and I noticed that there was a lot of areas that could be improved with processes. And what ended up happening, I didn't really want to focus on COVID-19, but it is what it is. It's a pandemic. So my presentation kind of did end up being a majority of COVID-19 related stuff, but that's fine. We are seeing, I thought we were seeing the end of the tunnel, but obviously we're having increased cases and people are starting to like lax on their, they're coming off guard. It's not, we've been at this for so long now. It was okay. I think it was still relevant to kind of go back and say, hey, these are some things like we need to be staying on top of, like don't get complacent, stuff like that. One of the main things that I noticed was that our screening, we're supposed to screen for vital signs at least once a day, and screening for COVID signs and symptoms. The support staff have been kind of laxing on that. And then as far as tracking, like there wasn't very good tracking going on. So like isolation, I think administration was, putting signs on the doors for people who are on isolation, but if you went down the hallway and asked people who's on isolation for what, they probably couldn't tell you. I know they couldn't because they couldn't. So anyways, I did the presentation. We went over the long-term care facility population, how, a majority of them are aging or they're for rehab and they've got comorbidities, and just there's a lot of different factors that place them at high risk when it comes to infections and outbreaks. And we went over keys to outbreak control, precautions, standard and transmission-based precautions, prevention, early identification, minimizing spread. And then we kind of went down the COVID route and we're talking about, did some anatomy and physiology. I really wanted to kind of touch on some of the things that weren't so commonly known. Like everyone knows virus gets in your body, destroys everything in its path, and you've got upper respiratory issues like fever, cough, blah, blah, blah. But I wanted to kind of elaborate on the lesser known things like the renin-angiotensin system, how You hear about the virus getting in through the ACE2 receptors, what that means, how that affects the body. The lesser known symptoms with like the long-term long haulers, post-COVID syndromes, stuff like that with the neuro issues. Just I wanted to break, out of the box of what everybody knows, and it's like blah 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 we've heard before. Let's see, and then went into the vaccinations, because obviously we have vaccines now, and that's a big push. We want, at least 75 to 80% of the population to be vaccinated to be able to beat the pandemic. And looked into, I found some resources that showed what kind of things help. Obviously going around bashing anti-vaxxers isn't going to make people get vaccinated, so went over some things for administration that could help, encourage people to get vaccinated in their staff. And some of the materials I used, I made a tracking tool for tracking who's on isolation. Very simple. That one was just, their name, room number, what isolation they're on, and for what reason, what's the rationale, and then start date and end date if you have one. And then a new tool for doing the screening for the signs and symptoms and the vital signs, because the process that they had initially was the nurse writes down the names of all the residents. That's writing 60 names down and what times you want the vitals done, and then you give it to the CNAs, and then they do the vitals, then they give it back to the nurses, and then they take that information and they put it in the chart. It was a 2-hour process for something that really doesn't need to take that long. I made a single sheet that you write the resident's name and room number, and it has slots for the entire month. So it's just one paper per resident, and just much, much easier to keep track of. Like I said, my audience was the administration staff at the Anna facility. I was able to get 5 people there, and that was difficult enough. So I hope that's enough. I think what worked well was just, I am very OCD. I go above and beyond with my sources and the information that I provide. So I think the information I provided was very good. What didn't work as well was, trying to get the audience there, getting them involved, like just getting people engaged seems to be very hard. Not everybody's going to be as passionate about something as you are. So getting the other people to care more about something that you care about, I think is one of the hardest things when it comes to leadership management, process changes, stuff like that. What would I change if I did the presentation again? Honestly, I tried my best to be concise, and it still went like forever long. I think my presentation was 36 minutes long, and I talk kind of fast, just trying to be more concise and to breathe. And when I get super nervous, you can tell I was just a wreck. Like, I shake, my voice is real bleh. Yeah, so honestly, if I could change anything, I would change my anxiety and just be the best public speaker there is, but I can't really change that. So I think just trying my best to give the best presentation I can is all I can do. I know I forgot to hand out the audience evaluation things like on the camera. I don't know if that had to be included on the video or not, but I passed those out afterwards. And then like I said, getting the audience involved, I struggle enough with just getting through public speaking, so I don't know if I had the best involvement. I know I was trying to be more conversational and not just be reading from. So I was trying to be more conversational and less of just reading from my notes, but I definitely didn't want to get sidetracked and lose my train of thought with all of the anxiety going through my head. So I was also trying to stay on, on my outline, on my, train of thought. And yeah, so that's it. I think I will continue to just try to make improvements to always work smarter and not harder, and take that with me. So, all right, thanks.